Good afternoon, everybody. Happy Sunday. And this is the third video which I am uploading today on Sunday. This video is regarding the case of an 80 years female who was having complaint of bleeding PV on off since 1 or 2 months. And one thing that I would like to advise you to every sonologist, every doctor who is doing the ultrasound, is that whenever the old age patient is having bleeding PV, please don't do ultrasound with the convex probe, because I already did the ultrasound of this lady by the convex probe, and the uterus was looking absolutely normal by the convex probe. But as the age was very advanced, 80 years, and the female was having bleeding PV, so that is little bit we have to do the scanning of the uterus very seriously. And for the serious scanning, the best scanning, we should always do the transvaginal probe scanning. No matter what is the age, whether she is old, that is not our concern. We have to just do the best diagnosis, best reporting, best observation that we see. So let us start that this 80 years female patient, already I had given the history of bleeding PV, and this was the uh, finding. Where is the video? Yeah, this. You look at this uterus by convex probe. There was no any doubt regarding that this kind of uterus is present, in which the endometrium is so thickened and is involving the myometrium. This endometrium was involving very close to the serosa, and it was showing very high vascularity. This much very high vascularity is a sign of C endometrium. You see, this whole uterus is having lot of vascularity inside this endometrial cavity and in the myometrium. In myometrium we can see little bit vascularity, but this in within the area of the endometrial cavity, this much vascularity is very high. And the another thing in favor of this C endometrium is that the vascularity is scattered. Okay, so you see the scattered vascularity. There is no any defined endometrium or endometrial margin, and the uterus was very small. And I did this ultrasound by this transvaginal probe, and now you see without color Doppler in this picture. This is the uterus, this is the cervix, this is the fundus of the uterus, and this is the endometrial cavity. No any well defined endometrium or the margin of the endometrium is seen, and this what you say, very heterogeneous texture of this endometrium is present. You see here, this here. And subjectively, if we see that this is the endometrium which is reaching very close to the serosal layer, this hyperechoic white area, this all this is the endometrium which is invaded into the myometrium, and no any well defined endometrium noted. So quite easy diagnosis. But if we do with the transvaginal scan, transvaginal scan is very important, and one should do the transvaginal scan in each and every patient, irrespective of whether the patient is having any gynecological problem or not. Without doing the transvaginal ultrasound, or at least without seeing the uterus and the ovaries adequately, the ultrasound scan is not a good scan, and we can miss the diagnosis. You can see here this endometrium. There is no any defined border or the texture, nothing. A very interesting case. Thank you.